Good morning, everyone. Probably good day, everyone, because we don't know who's watching. So we're back again on the CHES channel with Samantha Perez, who happens to be the expert, and Ruben, who happens to be a candidate. So
Ruben's also an expert.
on that. So today we're probably going to be looking at area of responsibility 6. And coupled with that, like I was telling Sam before we started recording, we have a bunch of CHES questions and maybe 4 or 5 MCHES questions at the end of the whole thing. So we have a feel of both sides, So I'm going to start sharing my screen now. And from there, we begin. All right. Okay, so Sam, can you see my screen?
Yes, I can. Looks great.
All right. And what about the font? Is it okay?
Font's great too. Yeah.
Sounds good. So CHES question area 6, which is advocacy. You know what, Sam? I was thinking of something.
What?
What if we get to this exam hall on that day, and the first question you see is for you to arrange all the areas of responsibility according to their numbers?
Well, if that were the case, then that'd be an easy question. But
Okay.
also to start off, responsibility 6 is actually communication, not advocacy.
5 is advocacy, right?
5 is advocacy.
Ah.
So starting off. I think these are communication questions though. I think maybe just your title. It's not advocacy. We're talking about communication today.
You're talking about communication, right?
Yeah.
Okay.
I think these are, does that change your questions? You pulled area 6, right?
Yeah, I think, let me see. Let's just see 1 or 2 questions.
Let's double check.
Okay, yeah, it's communication.
Okay, perfect.
So are we still good?
We're still good. Yeah, no, we're still good.
Oh, look at you. I think you're ready for the exam.
I mean, yeah, it'd be an easy question on the exam. I don't think they'll give us such an easy question, but yes, just to clarify, guys, talk about communication today.
Right. And we were getting ready for advocacy, and all of a sudden now we really have to change our mindset to communication. That's really interesting. All right, so yeah, let's begin. Let's begin. Do you want to go first, and like we did the last time?
Yeah, sounds good. Do you want me to read all of the questions this time, or would you like to read some today?
I'll read some.
Okay, perfect. I'll start off then.
Okay.
All right, so question number 1 is, a health education specialist is working with a local community organization to segment the population for implementing a new health communication campaign to address rising rates of sexually transmitted infections in the community. What characteristics will the project lead focus on to effectively segment the population? So first being A, location of healthcare resources, B, program components needed to effectively implement the campaign, C, behavioral, demographic, and cultural characteristics of the population, or D, duration/time frame for implementing communication activities. So we're looking of how the program lead wants to segment the population. And when you're working with communication, you're mostly looking at more of like the people, I would say. So I would say C, behavioral, demographic, and cultural characteristics of the population.
Right. And I completely agree with that too. And the question also said segmenting the population. So how do you actually divide the population? You divide them based on the behavior, the demographics, the culture, and those things. Okay, sounds good. Looks like we are off to an easy start.
Easy start so far. It was a long question, but easy start. All right, Ruben. Right. You next.
Okay. Let's see. Question 2. Which of the following is true about conducting an outcome evaluation of a communication campaign. Health education specialists are assessing A, if certain materials are more effective than others, if expenditures are within budget, if the intended audience are being reached with the communication outreach, D, the degree to which the communication objectives are achieved. All right, so the question says, when you're performing an outcome evaluation on a communication campaign, what are you looking for? So one thing I love to ask myself now is, why do we do an outcome evaluation?
To see if we achieved our goals.
If we achieved our goals and objectives. So yeah, I think the answer is kind of pretty straightforward. The degree to which the communication objectives are achieved. And for those watching at home, now imagine if this was to be maybe not a communication campaign, a social media campaign. The answer is still going to be to which the social media objectives are achieved. So outcome evaluation is about achieving objectives. So D, the degree, I'm just going to copy and repaste right there to
Perfect.
which objectives are achieved. Okay, 3.
3. A health education specialist is interested in gaining the support of a large number of people from a metropolitan area in which the project is being implemented. Which one of the following communication channels would be best to use? A, mass media, B, interpersonal, C, intrapersonal, or D, institutional. I've taken some skills from Ruben since the last video, and when I hesitate on a question, I always go back to the question and look for key terms. So again, the key term is large number of people in a metropolitan area. So what communication channel could you use just for large number? It'd be A, mass media, because you'll get the greatest number of people reached when using mass media.
Right, mass media. All right. And you know, it says metropolitan area. So you're looking at what is the characteristics of a metropolitan area? Maybe somewhere with good internet, civilized, and all of those things. Okay, question number 4. When health education specialists conduct trainings, it is important to use a variety of resources and strategies to A, ensure that all necessary material is covered, accommodate funders' expectations, reduce the cost associated with training, and D, reach as many of the learners as possible. Interesting question. So when you conduct a training program, why do you use a variety of resources? First of all, when we use variety of resources, it means we have a diverse population. Now, what does a diverse population mean in terms of communication? It means the literacy level is different. How they understand things, maybe an adult class, a young people's class, and all of those things. So I would say why we use that is D, to reach as many learners as possible, because audience is always going to vary from population to population. So D, reach as many of the learners as possible. Okay.
Yeah, absolutely agree.
Okay. Number 5.
Number 5. When health education specialists are asked to verify the credibility of media sources for health information, they should consider the element of currency. To what does this term refer? So A, the monetary value of the media organization. B, the amount of federal funding received by the media organization. C, how current or out of date the health information is for their health topic. Or D, how important the health information is for the priority population. So the term currency, it's something that's discussed in the book. So I feel like this is just straight definition and knowing what's associated with the term currency in media. So I know it's easy to think that, oh, it's monetary, but actually when it comes to communication with health education specialists, your currency actually refers to how current the information is to date. So when you think currency, you think right now. So how current or out of date the information is. So I'm going to go with C.
Awesome. I absolutely agree too. And you know, for this question, I'm probably not going to think of currency. You know, while you were reading the question, I thought about the word credibility of the media.
There you go.
Right. So I think I might have picked my answer from an aspect of credibility, and obviously you picked yours from the element of currency. So yeah, I think that's awesome. That's awesome. So how current the out of date the information is. Okay. Question number 6. A health education specialist is collaborating with community stakeholders to create a health communication campaign in which mammography screenings are promoted broadly among African American women in the Southeast United States. Which messaging technique would be most appropriate? A, tailoring, B, narratives, C, targeting, and D, audience segmentation. This is an interesting one. Okay,
A little
so
bit of a tricky one, I would say.
yeah, because of the options. So let's do it this way. Now we want to conduct a mammography screening among African American women. Now, all of this could be, they are all narrating messaging techniques, all right? However, the top two, in my opinion, and in the books that we're reading for this exam, is either tailoring or targeting.
Absolutely.
So the question is, how do you choose between tailoring or targeting? Right? So I'm just going to pick the answer, then I'm going to explain. I think the answer here is C, targeting. All right. And this is my simple explanation. You know, growing up in Africa, when you go to, is it called a tailor? Are they called tailors in the United States? Or
tailors like for suits and for clothes.
Okay, let's use the word tailors.
Okay.
So when you do tailors in Africa, they measure you personally. It's just particular to you, just one person. So that is how I got to understand this part of the communication strategy. When you tailor a message, it's not going to be to a group of people. It's probably going to be to a certain patient or just one person. However, when you target a message, it becomes a group thing. So in this case, the message you are promoting is to African American women, which is a group, not an individual. So the answer should be targeting. So if you are listening out there, every time you see this kind of question in the exam, always remember tailor is to a person, targeting is to a group of people. So that makes a difference. How do you approach this question, Sam?
I think when I read this, I think, I don't know why, but my first instinct looked at promoted broadly among African American women. So when I think broadly, again, when I think of tailoring, it's so specific, almost too specific, and targeting was definitely more of a broad term to encompass this kind of population. And when you read through the book, you always read the term target population, never tailored population. You always read like target population, something we're familiar with, whereas tailoring to individuals is something that you've read. So I agree. I believe the answer is C as well.
Very good. All right. Next question.
All right. Next question. Health education specialists are encouraged to employ health literacy universal precautions when interacting with patients and delivering health education materials to communities. According to the Agency for Healthcare Research and Quality, AHRQ, Which of the following is not considered a health literacy universal precaution? So A, use short sentences consisting of no more than 25 words. B, supplement text with relevant multimedia, including images and videos. C, use numeric rates and statistics to enhance the credibility of your message. D, highlight, bold, or create text boxes to display important main points. So just right off the bat, my first reaction is C, dealing with the numerical rates and statistics, because while that is good for credibility purposes, when you're delivering and interacting with patients, they're not so interested in the rates and statistics as much as you think. So, and it's not considered a universal precaution. So like using the short sentences, using images, using bold points, that's something that's going to get the patient's eye. So while A, B, and D are all good strategies, C is not necessarily considered a universal precaution. So my answer is
Right. I completely agree with you too. I think, data can never be overrated, right? Never. Absolutely, it's important. But I think in health education, it's not as important as passing out the main message. Because you just don't. Okay, let me give this example quickly. A few weeks ago, last month, I was at West Fresno Family Center, right? I was supposed to take a class, an adult class, all right? It's a training. So I and my supervisor, we made this PowerPoint. It was filled with data. We were having percentages and statistics and all that. So by the time I saw the people coming into the hall, I went to meet my supervisor. I was like, I don't think this presentation works here.
right.
Because I could literally see the people coming in and your instinct could tell you, these are not data people. These are people who just came in to hear the basic things and go.
Absolutely.
So it's absolutely, it's one of those things you want to take into consideration every time. So, all right, question number 8. If a health education specialist were creating an intervention that included writing education materials, which of the following should be checked to best facilitate learning? A, cost of a 2-color brochure. B, literacy level of all in the priority population. C, reading level of the written materials. And D, health records of those exposed to the intervention. So the question is saying, we are creating an intervention that includes writing education materials. So how do you best facilitate this learning? So what's going to help you? So I think the answer here should be C, the reading level of the written materials. Because again, one of the federal laws in the United States is the Plain Writing Act, where every single person must literally be able to read and understand whatever you give into them when it comes to health education. So I think that is something in area of responsibility 8. It's also a question there. So they must be able to read the level of the written materials. And also, let me add this quickly. I'm going to add it in the answer. Maybe people want to check on the word smog. It's actually one of the most popular questions in CHES. I think last year they had about 2 questions on smog.
Okay.
Yeah. So it's a readability measure. Let me just read.
I was like, yeah, maybe put it in there.
Readability measure. So I think it has about some stages and steps, and it's absolutely related to this question. So yeah.
Got it.
Okay.
Sorry, I'm looking at my notes really quick. I'm trying to figure out where it went. Because I had something I wanted to add to that, but I might just have to put it in the comments like we've been doing.
Okay.
Oh, maybe it is in the. Dang, I thought I had it. All right, I'll have to find it later.
Okay.
Okay, so a health education specialist wants to ensure a fact sheet on colon cancer prevention is suitable for the chosen priority population. Which of the following assessments should be used? So smog, SAM, fog, or FRI. So like Ruben said, smog is the readability measure. SAM is, I believe,
Sam is your name.
yeah, Sam is my name. That's, yeah, for me. And I totally forgot what it stands for. I was studying this over and over because I was like, it was something I would remember. Oh man, it's escaping me right now. Something measure. I think. Oh, suitability assessment of materials came to me. I was like, oh my gosh. Yes, suitability assessment of materials is what SAM stands for. And then you have fog, and then you have FRI. I can't remember what FRI is. Do you, Ruben?
No, I'm not even sure. Have I seen it? I'm not sure.
I don't know if I've seen FRI before. I've seen fog, but I haven't seen FRI.
Right.
But so just by process of elimination, it's not smog and it's not fog. It's actually SAM, which is a
Right.
suitability assessment of materials. So for that, because you want to double check a fact sheet for a priority population, that's the kind of assessment. Since you're giving a fact sheet, it's like a material, right, that you're giving. So that's what you would use to make sure that it's suitable for this population. So the
Okay.
answer would be SAM.
Right. So suitability,
Assessment of materials.
man. And you know, I've been saying this also, that we all need to know the meaning of these words.
Mm-hmm.
Because in a situation like this, if the only thing you truly know is smog that you've seen in the book, and you've never seen these other three, you're probably just going to say the answer is smog.
Probably.
So I think it's very important to understand the meaning of these acronyms, All right, number 10, the route through which a message is disseminated to the priority population is referred to as the communication what? A, means, B, channel, C, strategy, D, intervention. Interesting. All right. So, all right. So let's start from option D. It's not intervention. Intervention is the whole thing that you do. Okay. Yep. It is not strategy either. Now, however, I could make a case. I could make a case for A or B.
I could as well. I mean, let's do it. I mean, okay. I think I know what the answer is, but let's say it's, yeah.
Right. So I'm gonna make a case for the wrong answer.
Okay, go for it. I will as well.
Okay, I'm making a case for A.
Mm-hmm.
And this is it. Communication means. Let me make a case for the wrong answer, and it's really difficult to do for me right now.
It's really hard. Let's say, well, communication means like a means of communication. So we'll say, I feel like that's a term. Like, what's your means of communication?
Right.
Like very popular saying, like in English, and the means of communication is like how you're doing it almost. So like, how are you doing it? Are you gonna do it over the phone? Are you gonna do it on
social media?
Yeah, on social media. So that could, it's tricky, like means of communication, but right. It's not the right answer.
It's not. So I think the right answer should be B, channels, right?
Mm-hmm.
So channels of communication. You know, I absolutely think on another day, if this was not a CHES exam, let's say it's an English exam. If it's an English exam, yeah, I would probably just go with A, means.
Mm-hmm.
Yeah, but for the severity of the exam, I'll just go with let's go with B. All right.
Yeah, and this is another example, everyone, of how in order to for studying for this exam, you'll recognize certain vocabulary that's consistently used for the book. So while like in English, we're like, oh, means of communication, like what are your communication means? In the book, when you're looking at the chapter as a whole, it always says like communication channel of communication. So I think it's kind of just switching your brain over to thinking like a health education specialist for this exam. And I think that was a tricky one because they definitely put that in there just to slip everyone up.
It is
Very tricky of them.
If you remember the presentation we made on Tuesday, what we had was communication strategies, actually. So, and we included mass media and all of those things. So strategy could also, anyone could have, just look at this option and be like, well, now let me just go with one of them. So, boy, like you said, you need to find a particular word that is consistent with the book and the chapter that was done, right?
Absolutely.
So 11.
All right, 11. A health education specialist can design health promotion programs to facilitate the learning process of all participants by A, developing universal messages to reach diverse populations, B, adapting programs to different cultural beliefs and practices, C, being aware of cultural bias and developing educational programs, or D, replicating programs that have been effective in dominant cultures. So if you're looking to design a program to facilitate the learning processes of all participants, so you're looking again just at the people that are coming to your intervention. So you're trying not to, you're not putting a message out there, you're presenting to people who come to a specific program. So when you're narrowing it down, I automatically think of adapting programs to different cultural beliefs and practices. So my answer automatically goes to B. While being aware of cultural biases in developing programs is also good. For this one, you definitely need to adapt, not necessarily replicate like D is saying, or develop universal messages, because that's not what you're doing. You're just doing it for this promotional program. So my answer is B.
Right. Okay. And I also agree with you. And, again, back to how I approach the questions. What is the key part here? The key part here is all participants. How do you get everybody involved, irrespective of their culture? And, I was saying to myself some days ago, I think in the near future, CHES is probably going to have a section on culture.
Oh, absolutely.
I honestly believe that. I think they're probably going to do something on culture and make it like 9 areas of responsibilities.
Yeah, I think they might, because right now 8 is what, ethics, so they might have to just like slip that in there. But no, I absolutely agree.
Yeah. All right, question number 12. A health education specialist creates a draft fact sheet about diabetes. A group of 6 individuals are recruited to read the fact sheet and answer a series of questions. This process is an example of what? A, pilot testing, B, readability testing, C, tailoring, D, cultural competence, C, okay, 12, what do I go with here? So you're creating a draft fact sheet about diabetes and you've asked a group of persons to come check it out, okay? So what you've basically done is you are not testing their readability level actually, because in this case, you have tailored a certain message with a certain level of, how do I put this? What do we measure readability level if the material is accessible, understandable by everyone, right? Interesting. Okay.
Yeah, sorry. I'll let you finish your thought process and then I'll interject.
Okay, so I'm gonna go with, okay, I'm not going with tailoring. Tailoring it has to be specific to a person. Already in this case, you have about 6 individuals. That is obviously targeting. And cultural competency, you are not particularly testing out the culture here. You are trying to, it's a kind of process evaluation at this point. So you are kind of trying to evaluate the process of the whole program. I think the answer is pilot testing. I think the answer is pilot testing. You've created the material. You need people to assess it, get feedback, and improve on the material. So what you're doing is pilot testing. What do you think?
I agree. I think it's also pilot testing. I'm just trying to verbalize my thought process as to why it's not readability testing. Like, it's not readability testing because I don't think you really test for readability. Like, it's the readability standards are something that SMOG has already put out there. So it's already a thing. If you're giving people the fact sheet already to answer questions back, you're basically testing it. You gave it to them, you're getting their feedback, which is the pilot testing. So
okay, sounds good. All right. I think we're having an easy time with communications.
It was, again, communication was something I presented on in our class. So in our graduate class, we have to present on one of the areas each semester, and this was mine. So I'm good on communication.
Okay, I see. All right, 13.
All right. So when designing audience-centered, culturally appropriate health education materials, it is essential to A, involve the target audience in developing the materials, B, outsource the publishing to another agency, C, keep the production costs low, or D, determine education level of the target audience. So immediately I'm nixing B and C. Outsourcing to a publishing company and keeping costs low is not your priority at the moment. So I'm looking at A and I'm looking at D. While it's good to determine the level of education of your audience, I think it's more important to get their feedback and having them involved in the process. Again, that's something as health education specialists that's emphasized at the very beginning of this book, is having everyone involved in developing these materials. So I'm going to go with A.
A, all right. So yeah, I think that's absolutely right. And obviously for B, if you look at B, you are technically giving it to another agency who probably doesn't even know what the culture of that place is.
Yeah,
so,
absolutely.
We have, what do we have again? A.
A, involve the target audience in developing
the target
materials.
audience in developing these materials.
I like how you used to do copy paste and now you're just physically typing now.
Okay. Can you hear me now?
Yes.
Okay. Question 14. A health education specialist in a hospital plans to post information throughout the facility to increase awareness of the potential danger, spread, and prevention of COVID-19. Which format will best accomplish this effort? So basically, you are trying to create awareness, spread the message, which is about reach. You are also trying to create a prevention program avenue. So what do? A brochure containing detailed information, data printed from CDC website regarding COVID-19, an infographic with data and short messages, graphics showing proper hand washing. So let's start with the least correct answer. It's not going to be graphics showing hand washing because hand washing is not the only prevention technique for COVID-19. So let's get it out of the way. All right. So a brochure containing detailed information. Now, one of the things about posting information is not just about the detailed information, it's actually about the practicability of the information. So it can be detailed, but not practical. So I'm going to struggle between B and C. Actually, I shouldn't struggle between B and C.
Because it was similar to a question that we had earlier of credibility, which you'd get from printing from the CDC, or being short and sweet with it.
Right. Interesting. Interesting. This is interesting. So if you print the data from the CDC website, well, you're getting it from a credible source. However, you just printing material from the credible source does not mean it's going to increase the awareness, does not mean it's going to aid in prevention, does not mean it's going to aid in communication reach. All right. In fact, as a matter of fact, if Dr. Fauci posts the information itself, doesn't mean we are going to believe it. So yeah, I'm going to go with a C, an infographic with data and short messages. And why is that? People respond to pictures, they respond to images, coupled with data and coupled with messages. So in this, in fact, in this option, I think you've solved 3 problems. You've solved the problems of those who particularly won't understand the message, but we understand the images. You solve the problem of health education specialists who are not interested in images, but are interested in data. And you've also solved the problem of those who are just there, you know, readability level is low and they can understand. All right, I hope I'm not going with the wrong answer. What do you think?
You have the answers to these. I'm pretty sure it's C, but if it's not, then tell me now.
Yeah, I think it's C too. All right, 15.
15. A health department conducted a social media campaign for its new childhood immunization clinic to drive community members to the department's website for appointment scheduling. The best data to track using the website's analytics would be which of the following? A, organic traffic, B, goal behavior, C, direct traffic, or D, interest volume. Honestly, I look at all of these terms and I have to start dissecting them one by one. Because you have traffic, you have interest, you have behavior. And again, these are all terms from the book that you should be familiar with as well. So I'm going with what Ruben did and look at the question and what are the key aspects of this question. So you're looking at a website that you want to initiate an action by the community for appointment scheduling. So you're trying to get them to actually do something. So automatically, I think behavior. You're not necessarily, you're trying to get it out there and trying to get people to come to the website, but you're also trying to get them to schedule an appointment is what it seems like. So organic traffic, direct traffic, interest volume. Direct traffic and interest volume is basically like the number of people that come by, from my understanding. I'm not sure what the difference is between those two.
Which one?
Like direct traffic and interest volume.
Okay. I think when you talk about direct traffic, I think it's directly the number of people per click. All right. Maybe direct traffic after. Okay, so let's do it this way. What is organic traffic? Organic traffic are the initial users of your website. You didn't pay for ad, you didn't do anything, they just found it. Direct traffic, you've probably paid and they are now clicking and subscribing. And interest volume are just probably the number of people, you know, just as the name implies. So
got it. And while all those terms are great and deal with just like the number of people, again, you're looking at like a behavior of appointment scheduling. So that's why my initial reaction is to do goal behavior.
Right.
So you want to track the goal behavior that you're getting from this website, because the purpose of the website is to have people schedule their appointments on here. So the best data to track would be the goal behavior data.
Right.
I don't know if, am I right? Am I right? Is that the?
Yeah, I mean, yeah, I think so. I think goal behavior seems right.
Great.
Yeah, I think goal behavior, because, and again, all of these things, you see, organic traffic, direct and interest volume, I think it only helps you to measure the reach of your message, which is not what we are trying to do in this question. We are not looking at the reach of the message. We are not looking at the exposure of the message. We are looking at what changes in the people clicking your website. So goal behavior. All right, question number 16. A formal social media policy should include the use of what to maintain pages, post schedules messages, and respond to follow-up posts. Interesting. A formal social media policy should include the use of what to maintain pages. Interesting. Okay, I don't think it's tagging. Okay, so I think these are basic social media words. When you tag someone, it's a specific person, right? Like you want them to see the specific thing. However, in this case, you're trying to post messages, respond to follow-up posts, a lot of people. How do you do it? It's not a network. Okay, I'm gonna go with D.
I agree.
I'm gonna go with D. I just went with D and I don't know why. Do you know why?
I went with D because I think it's more of a, it seemed more, I don't want to say, what's the word I'm looking for? Like not so broad, specific. Because absent networks, they're technically like the median as to when you do that, but a moderator is like a specific person, I think by definition. So they're the ones who can actually respond. That last part, respond to follower posts, some one person has to do that, or some, gosh, I'm not explaining myself. But like it's the duty of an individual, not necessarily an application, I guess, is what I'm thinking. I think that's the right answer, right?
Yeah, it is the right answer. And
Okay.
I also think this question is really about a person and not a thing.
Okay.
The question is about the person, like who does this job? Well, you know, this is actually someone's job description.
Yeah, there you go.
Right? It's actually someone's job description. So
that's what I was trying to say. Like it's the duty of like a specific individual. You can have multiple individuals, but like a specific.
Right.
Yeah. Okay.
Question 17. In a health communications campaign for a walking program, it was emphasized that exercise can make a person feel better. I agree. Other people are starting to participate in group fitness walks, and it is easy to reserve time in busy schedules for a short walk. The most likely behavior change theory on which the campaign was based is which of the following? Health belief model, bless you, Sam. Health belief model, social cognitive theory, theory of planned behavior, and transtheoretical model. Interesting. So this is a long question, and I really hope we don't have questions as long as this.
I mean, I feel like this is as long as it's going to get and as complex as it's going to get, because it's going to make you pick a theory. It's going to make you think and contemplate a little harder and go through the theories in your head and see which one matches this the best.
Right. So let me see. Now, you're campaigning for a walking program. You've emphasized that exercise can make a person feel better, and people are starting to participate in your exercise. Now, it's easy to also reserve time in busy schedules for a short work. Now, health belief model is not the answer here, because technically health belief model just helps you to assess the level of a disease. What is your susceptibility? How do you perceive the disease? That's not what we are doing here. Now, social cognitive theory.
Probably one of my favorite ones.
And let me digress a little. I was asking one of the guys that defended the project last week. Everybody went with social cognitive theory.
Mm-hmm.
It's crazy. You know, when Said presented on COVID, I told him, I said, Said, I think you could have gone with health belief model and it would have made sense.
True.
Because it's COVID. A lot of people believe they shouldn't take the vaccine. Some people believe they should and all of those things. And it was surprising how people love social cognitive theory.
I think it's because we're in a society where I feel like doing, oh, how do I phrase this? Such like a broad idea that I was having. Like, it's not so much that social cognitive theory focuses all of it on, oh, I'm doing this because other people are starting to do it. But we're definitely a society, at least here in America, where the majority of our population does something because we're influenced by others, or we're motivated or unmotivated by others. So that aspect of social cognitive theory I find super interesting.
Yeah. That I think for me in this program, the best theory has been Transtheoretical and health belief.
Fair enough.
So back to the question. So
Back to the question.
it's not health belief. For this social cognitive theory, we are not necessarily assessing the community, a population's attitude to a program. It's just a campaign that is running and people are signing up for it. So we are not testing people's attitude to it. So I am torn between theory of planned behavior and Transtheoretical theory. Now, I'm going to go with theory of planned behavior. I'm going to go with theory of planned behavior because, number one, it is an individual level theory. Social cognitive theory and health belief, social cognitive theory is not an individual level theory, absolutely not. It can either be a community level theory or the intrapersonal level theory. And what we are doing here is a person, all right? So it is a low level number of people. Now, for this Transtheoretical level, we are not talking about what stage are these people in. Because in Transtheoretical, you have the pre-contemplation, contemplation, action, maintenance, and termination. Right? So we are not talking about what level are they in this process. That's not the question. So the theory of planned behavior is you have organized something and people just buy into it because they perceive it can help them.
I think it's perceived like benefits, feasibility, and I forgot what the one regarding like other people participating.
Right.
It's the three things, which is what the three things it talks about, emphasizing that it can make you feel better, which is the benefits. Other people are starting to participate, which I think, I don't know what the term is, community. And then how easy it is to reserve time in busy schedules, so feasibility. Right. So my answer, yeah. So theory of planned behavior for sure.
Behavior. And I think one of the things I've done well with these theories, or I tend to understand them, is to immediately understand, is the question talking about a community level, an individual level, or an intrapersonal level?
Good strategy. I would totally agree with that. If you're approaching this for the first time, these theories, start with what Ruben said. Is it an individual theory or a community theory? And how does that relate to the question? Right. No, good strategy there.
Because for me, I could honestly make an argument for Transtheoretical, but the fact that the question is not saying which stage are they in. Transtheoretical is all about the stages. So, yeah. All right, question number 18.
Is that me?
I think so.
Okay. Let's see. Set of communication tools for education and persuasion using paid media is which of the following? Advocacy, promotion, publicity, or advertising? An easy one. Oh man. I mean, should we talk about them or should I just give the answer?
Interesting. I want you to talk about options C and D.
Okay, so let's advocate for C and D. So let's start with C. I'm making a case for publicity. So publicity is getting your message out there. Well, I guess publicity is getting a lot of people to listen to you, is what I think about it. The answer is advertising. So like advertising, you're paying for it, and you're using a bunch of media, you're getting it out there. So great communication tool. But if you're like looking at publicity, yeah, it's basically getting people to look to you for whatever's going on, I guess. I don't know, how would you define publicity?
Yeah, I think I would define publicity as a form of advertisement, actually. Right?
That was the word I was looking for.
Right. So, but I think the trick in this question is you are paying. You are paying money. So anything you pay money for, probably just advertising. So, right. So,
and this is just fresh in my mind because Ruben and I just did an assignment together on Tuesday about advertising. So
right. So where we say we're going to pay for our Instagram page, right?
Yes, we're going to pay the Instagram fee to just have the advertisements and advertise our page.
Right. Okay. Question 19. A social media campaign leading with Facebook for its new drive-through immunization clinic was conducted in a health department. The health education specialist used the platform's analytics to determine the number of unique people, emphasis on unique people, who viewed the initial clinic kickoff post, emphasis on initial clinic kickoff post. The health communication specialist is evaluating which type of social media reach. Is it A, paid, B, organic, C, viral, and D, likes? So it's saying now, unique people and initial kickoff post. How do we do this? Should I just go over the answer and?
I go by process of elimination. Why is it not this?
Okay, by process of elimination.
Yes.
Okay, by process of elimination, the keyword we are going with is unique people, right? So unique people is defined in terms of people who did it voluntarily. All right. They didn't pay for you didn't pay to get them to do it. You probably did a snowball to get them and all of those things. So it is not paid, because when you do for paid people, it is no more unique. It becomes the general population. All right. Viral. Here we are not talking about having like 1 million impressions on Twitter or 1 million likes on Instagram.
No.
All right. Yeah. And likes, we are still not talking about the number of people who went onto your post and are interested in the campaign. Now, the question is just asking, how do you determine the number of unique people? And when we say something is unique, it is organic, right? It is straight from the farmer's hall. Like, you've not done anything to persuade people, you've not paid for advertisement, you've not induced the people, there are no incentives involved, right? They just did it for you. So B, I'm gonna go with organic. I hope that's the right answer.
I think it is.
Yeah. So 20.
Let's see. In a health communication campaign, stoplight, so red, yellow, or green, characters are used to encourage adult immunizations. the most likely behavior change theory on which the campaign was based is which of the following? So A, health belief model, B, transtheoretical model, C, communication persuasion model, or D, information persuasion matrix. So again, this is all about knowing your models and your theories and the differences between them. I will say chapter 6, I'm more familiar with just because I presented, but I think chapter 6 is actually one of the longer chapters in
I
this
think so.
book because there are so many communication theories. So if you haven't done so already, I suggest you make flashcards and familiarize yourself with them. So as Ruben was talking about earlier in a previous one, transtheoretical model is the model of stages. All of the stages is highly emphasized. So just looking at using the stoplight campaign of red, yellow, green, and those as indicators, my answer for this is transtheoretical model. But let's go over the other answers, just so we know like it's not that. So A, health belief model, doesn't really seem to have anything to do with the stoplight campaign of red, yellow, and green to encourage immunizations. So looking at communication persuasion model. So communication persuasion, can be used to help define steps in which an individual proceeds to engage in behavior change. But I don't know why I'm hesitating on that one. Could be C. I don't think it is C. I'm trying to look at my notes again.
Okay.
But I think the communication for persuasion is more in depth about personalizing the behavior for the communication persuasion. Like you're trying to persuade someone. So I think it's more dealing with like the personalizing, the accepting, the remembering of the communication persuasion model.
Right.
I don't think it's that one. Information persuasion matrix. Don't remember what that one was either. Do you?
I don't think I saw that in the book.
I don't know if it's anywhere in the book because that I was like, I don't know if that's something that was discussed. My answer's still B.
Yes, I still do, right? So
yeah.
I think that
Is it right? I don't know. Maybe it was C.
Yeah. Let me see. Transtheoretical. I think it's right. And you know something? Let me ask you this. And just in case Dr. Perez watches this video someday, I hope he's okay with this. You know how it tells us to not read so much into the question. I don't believe in it.
Like, don't read too much into the question?
Yeah.
Okay.
Because I think sometimes you really have to break down the questions to understand where they are coming from. Because you know what? In this question, I would have also picked B, which is the right answer. But I'm going to do it because I've never seen this before in my life.
I get it wasn't the only one. I looked at that and I'm like, is there a persuasion matrix?
Yeah.
Okay.
And because I also know this is not it. And because I know it's not, we are not trying to, you know, I mean, persuasion model, you are trying to encourage people, right?
Yeah, so technically, yeah, that's why I hesitated.
Would fly. So I think, now, let me tell you why I'm thinking it's transtheoretical. It says, and oh, don't say, oh, Ruben, you talk too far, okay? Listen to me. So it says, we are using the stoplight sign characters, red, yellow, and green. In transtheoretical model, what do? Pre-contemplation is you are not interested at all. And that is red. Contemplation is you are thinking about it. When you get to a yellow light at the traffic sign, they are expecting you to stop. And of course, green is you are doing it, you are moving, you are taking action. There is maintenance, and there's probably termination, which are the stages of Transtheoretical model. I thought too far. I don't think on the exam day I'm going to have that kind of time to think like that. So
Probably not. You only get 3 hours for 165 questions. So
right. Yeah, but I think in all, it is a Transtheoretical model because we are just really trying to assess at what levels are those people we are trying to encourage. Are they at the red level? Are they at a yellow level? Are they at a green character level? So I think that's what we're trying to do. So it's all about the stages. Okay, 21. I think we answered 21 already, which was theory of planned behavior.
Oh, yeah.
Yeah. So I'm going to take that out. So here we're back to 21. Now, to design the health communication messages and select appropriate media for a health education strategy, the health education specialist must understand the priorities and the influences of the audience. Therefore, the health education specialist first should conduct an audience what? A, influence technique, B, analysis, C, ideation procedure, and D, synthesis. Now, let me announce to everybody that we have moved into the CHES zone. And the question has, the language of the question has officially changed. You could feel the difficulty in even reading out the question. That's crazy. Yeah, so let's see. To design the health communication message and select appropriate media, you must understand the priorities and the influences of the audience. Therefore, how do you conduct, you should conduct an audience what? Interesting. Okay. You want to, I'm struggling to find a key point in this question.
I think priorities and influences of the audience is what we're looking at.
Okay.
So you must conduct a what to try and find out what are their priorities and what's influencing them.
Right. Interesting. I'm gonna go with analysis. I really don't know.
I think I'm gonna go with, it's not synthesis.
Okay.
I don't think it's influence technique because you're trying to understand also their priorities.
Okay. So what are you gonna go with?
I would say analysis because ideation procedure.
Right.
I don't know. I also lost you. Your camera's off.
Oh yeah. I'm trying to get my charger.
Oh no.
Yeah, so it doesn't go off. Right. So what do you think?
I want to say analysis.
Right.
We could both be wrong, but
Absolutely.
if I look at it long enough, I don't know.
I'm
gonna go with analysis.
when you conduct an audience analysis, are you not trying to understand what your population is?
Right? That's what you're doing.
Right. I mean, this is not like segmentation or something. You're just trying to have an idea of who you are going to be educating and these things.
You having technical difficulties over there?
No. It's gonna be over in a few seconds. So what's your answer?
My answer is B, analysis.
Analysis?
Yeah.
All right. So you want to understand the priorities and the influences of the audience.
So that would just be analyzing the audience.
Right. I mean, and sometimes it's not just as simple as that.
That's what I'm saying. It almost seems too easy. I think we just got intimidated that they were CHES questions, but
So I think so. I think so. All right.
all right.
Let's see.
What's the right answer, Ruben? Again, Ruben doesn't share these questions or answers with you guys. I know they're like in the book, but I try to keep it fresh.
Right. And I do it in such a way that I also compile the questions like the day we are going to do it.
Mhm.
So I don't really go back to read and get the answers beforehand and all of
Yeah.
it. So analysis. So before this section is over, I'm going to check for the answer and make sure we are right. Okay.
Okay.
Okay. Next one, 23. Oh,
23. The impact in the impact assessment of a health communications campaign evaluation plan, both blank and blank indicators should be measured. So individual and social, B, strategy and causality, C, activities and outputs, D, process and outcome. So when you're looking at the impact assessment of a campaign evaluation plan, I mean, my brain automatically goes to process and outcome just because it's something that we've talked about a lot, but I think it's different when it comes to communication campaign evaluation.
interesting. So
Because I know evaluation is a whole different chapter. Evaluation is a completely different chapter. When it comes to communications evaluation, yes, you have process and outcome objectives, but those are more objectives, not indicators. So I think the key word here, indicators, when you're looking at a communication campaign, I think you want to look at the either individual and social indicators or strategy and causality indicators. But even causality indicators make sense, but strategy indicators don't.
yeah, I think causality and strategy, absolutely not.
Yeah, I think I was so, and it's not process and outcome because those are more. I think it's trying to trip you up with the process and outcome. These are indicators specifically in communication. And when you're looking at that, you're looking at the individual and social indicators for
Right.
campaign evaluation. So my mind wants to go with A.
You want to go with A?
Yeah. And this is a tricky one, guys. Again, it's making you think a lot harder. You can obviously tell we're in CHES questions.
So for me, I'm also going to strike out strategy and causality. Absolutely not.
Yeah.
I'm also going to strike out process and outcome because every time we measure the impact, right? We measure the impact of a campaign or something, that is technically impact evaluation.
Yeah.
So it's a tricky one. Do I want to go with Sam on this?
What's the answer? You don't have, oh, I guess he has them in a different one.
Right. I don't think I have the answers to this interest.
Oh, sorry. Hold on. How many more questions do we have? Sorry, my phone keeps buzzing and I have no idea where it's at.
We have just 3 more questions.
3 more? Okay, hold on.
Yeah. Right. So bear with us, guys.
Bear with us, guys. Sorry. Oh, there it is. Hold on. Okay, all these things can wait. I thought it was something urgent.
Oh,
Sorry, we're on 24.
you're right.
24. All right, so the health communications campaign evaluation question, quote, is the audience more encouraged with the behavior change or issue? If not, how is the data used to explain why, unquote? Should be posed at which stage of the strategy? So if you're just listening to this on your phone or having this in the background, so the question, the evaluation question is the audience more engaged with behavior change? If not, how is the data used to explain why? What stage do you pose that question when it comes to communications evaluation? So
Right.
the options are A, early, B, middle, C, late, or D, post-program. So my initial my initial gut just says middle.
Middle. So
Because I think if you do it too early, you don't know if it's more engaging or not. And you don't want to do it too late, and you don't want to do it post-program, because you want to ask that question more in the middle, so that way you can adapt your communications campaign. And you're consistently evaluating as a health education specialist, so it should be done in the middle.
in the middle. All right. So let me also add a quick twist to it, which I think middle is the right answer. So it's asking you that you want to measure the behavioral change. Now, every time you measure behavioral change, that is impact evaluation. And when do you do your impact evaluation? In an ongoing program, right in the middle of an ongoing program. So the question is basically asking you, what time do you conduct an impact evaluation? It's all about behavior and attitude change. So you have to do it before the program comes to an end. So yeah. All right. And Sam, I checked for the answers for these two. We were absolutely right.
What? Go
Yes.
us.
Absolutely right. Spot on.
Wow. That was a lot of they're just so tricky. So tricky.
Right. Okay. 25. A health education specialist has finalized the marketing plan for an intervention. Feedback on print materials was received through focus group interviews. Prior to implementation, which method should be used to gather feedback on the entire intervention program? Interesting. So the program has started already. You've conducted a pilot test, and you have now you are into the process of implementing for the whole program. So here the answer is not a pilot test, because the basic thing you did from here to here, you've received through a focus group, you've conducted a pilot test. So which method should be used to gather feedback on the entire intervention program? It's not readability test.
I don't think so.
No, absolutely not. Absolutely not.
I'm trying to remember what the Delphic technique was. I feel like I just read that.
I think I read that in the other yellow book that we bought, the Mometrics.
Yeah, the metrics one.
Right. I'm actually going to go with Delphic technique.
Oh gosh, what was it? I think it was.
Because in this question, okay, pilot test does not give you a feedback on an entire program. it gives you the initial feedback in just a segment of the program. So absolutely not pilot test. You are not doing a readability test here. Now, what is a nominal group process?
I don't even think I've ever heard of that.
I mean, a nominal group process, I'm not sure I particularly know what that is.
I want to say the answer is Delphic, because oh God, was Delphic the technique where you bring it to, it's like you bring it to like a focus group or like a panel of experts, like
Okay.
consistently at different stages. I'm pretty sure that's what it is. Like it's basically you got your feedback through the focus group interviews. And so what method should be used to gather feedback on the entire intervention program? Delphic, which is basically just bringing in experts.
Okay.
But do you want the experts though? I think.
Interesting. This is something I have to read up today.
Write it down.
Yeah.
I literally just read it not too long ago.
Oh, really?
I think so. It's like multiple rounds to different experts. Like you do one round, you adapt it, and then you do it to another group of people, and then you readapt it, and then you do it to I think that's what it is.
Oh yeah. Okay. I'm definitely gonna check it out.
What's the answer, Ruben?
I actually didn't check for this one. So do you have the book?
Yes.
If you have the book, can you check questions, CHES question 49? I think it's either 49 or 69.
Not 49.
What about 69?
Nope.
How about 82?
Nope.
How about 96?
Yes. Answer is,
Let's see.
ooh, wait, 96? It's actually A.
Really? Final test?
It's pilot test, 96.
That doesn't make sense.
96 is A. Technically, it's from area 2. So maybe we're just all about communications. But yeah, it's A. No wonder the Delphic technique looked familiar, because I think that was in area 2. Yeah, it's A.
But how does pilot test even make sense here, though?
Which method should be used? Yeah, to gather feedback on the entire intervention program. Pilot test.
But yeah, the first part said they already got feedback on print materials.
Yeah, feedback on print materials was received through focus group interviews. They just gave feedback though. They wasn't necessarily pilot tested. People didn't actually physically do the well, I guess they didn't use it in the program. So pilot testing is actually using them in a program. For the feedback, it looks like they just gave them the print materials, like, okay, what's your opinion?
Right.
So yeah, it was pilot test.
Wow.
What?
I was so confident it's not pilot
You were
test.
so confident. Oh my god.
No.
Guys, Ruben can be wrong sometimes. I never thought I'd see the day. He's always right. Most of the time he's right.
Crazy.
That's
Yeah.
crazy. Yeah, it's pilot test.
And you know, the way I selected the CHES questions, I didn't particularly even read the questions. I just knew, okay, this is area 6. I'm just picking them at random.
Well, technically this is area 2.
Area 2, just imagine.
That's okay. Next.
Yeah, and I think going forward, maybe we should do something like this. Mix the questions a little bit. so we are not inclined to one area throughout the day.
Maybe we should do that when we finish all the areas. I don't think once we upload this YouTube of every area, then we'll go through and we'll do like a review. I think we answered this question already.
Yeah,
too.
we did already, and the answer
Okay.
was yeah.
Area 6, man. Whew.
All right, so we had 25 questions. That's crazy. Yeah, but I think we did well. This last question was the only problem. Yeah, absolutely, absolutely. Okay,
Mhm.
I actually had an amazing time doing this.
This is great. I love this. I know they take so long, guys, but if you're just like listening to this in the background, I hope you find it helpful.
I really hope so. I really hope so. Right? Okay, Sam, thank you so much for showing up and blessing us with your knowledge today.
Thank you again for having me. This has been a good study tool, I will say. So
Right. Super grateful. All right, to the guys out there, once again, if you have a different approach that you are using to answer these questions that we don't know about, right, that feels like magic to you, please share with us in the comment sections and let everybody know about it. Okay. All right, Sam, once again, thank you so much. Love, light, and appreciation.
thank you so much, Ruben. Till next time.
All righty.